According to the latest global statistic in 2020 by the International Agency for Research on Cancer, there were an estimated 19.3 million new cancer cases reported around the world. In 2020, 48,639 new cancer cases in Malaysia were reported by the International Agency for Research on Cancer in both men and women of all age groups. The top 5 most common cancers in Malaysia are breast cancer, colorectal cancer, lung cancer, nasopharyngeal cancer and liver cancer. According to Malaysian statistic for 2020, the most common cancer among men in Malaysia is lung cancer and the most common cancer among women is breast cancer. Breast cancer is the most common cancer among women in Malaysia with a total of 8,418 cases recorded in 2020. Next, 6,597 people were diagnosed with colorectal cancer, 5,139 with lung cancer. A total of 1,703 cases of nasopharyngeal cancer, 1,553 cases of liver cancer have been reported for both men and women.
There are many key terminologies that play a crucial role that can help us know more about cancer. Some of them include tumor, that is an irregular mass or clump of tissue that might be benign or cancerous. Other than that, we have neoplasm. It refers to cancer, which means new growth. Additionally, there's benign neoplasm or benign tumors. These are cancers that are unlikely to spread further and are limited to one area of the human body. Furthermore, there's non-invasive tumor. It is a tumor that has not yet expanded to a different part of a person's body but has the possibility to grow aggressively and damage other organs if left untreated. Apart from that, we have a metastatic or invasive tumor, which is a cancer that has begun to spread from one part of a patient's body to another. Moreover, there's tumor transformation that refers to the progression of a low-grade cancer into a high-grade cancer. Besides that, there's aggression. It means the possibility of a cancer spreading to other organs. A non-aggressive tumor spreads slowly, but an aggressive tumor spreads quickly. Lastly, we have an oncologist who is a medical practitioner who specializes in cancer treatment.
Cancer staging is a system used to describe the extent of cancer within the body. The most common cancer staging system is the TNM system, which stands for tumor, node and metastasis. Tumor describe the size and depth of the tumor. TX, which is unable to evaluate the primary tumor. TO means no evidence of the primary tumor, while T1, T2, T3 and T4 is increasing size or local extent of the primary tumor. Nodes refers to your lymph nodes. An X unable to evaluate regional lymph nodes, and 0 lymph nodes doesn't contain cancer cells, and 1 and 2 and N3 increasing involvement of regional lymph nodes. Metastasis describes whether the cancer has spread to different parts of the body. M0, the cancer has not spread to other parts of the body, while M1, cancer has spread to other parts of the body. Based on this TNM information, a cancer stage can be determined. Stage 1 is the cancer is localized to a small area and hasn't spread to lymph nodes or other tissues. Stage 2, where the cancer has grown but it hasn't spread. Stage 3, where the cancer has grown larger and has possibly spread to lymph nodes or other tissues. And lastly, stage 4, the cancer has spread to other organs or areas of the body. Even though stage 1 until 4 are the most common, there's also stage 0. This earliest phase describes cancer that's still localized to the area in which it started. Cancers that are still in stage 0 are usually treatable and are considered precancerous by most healthcare providers.
Cancer generally progresses from a precancerous lesion to a malignant tumor. These changes are the result of the interaction between a person's genetic factors and 3 categories of external agents, including 1. Physical carcinogens, such as ultraviolet and ionizing radiation. 2. Chemical carcinogens, such as asbestos, tobacco smoke, alcohol, and aflatoxin. 3. Biological carcinogens, such as infections from certain viruses, bacteria, or parasites.
On top of that, oncogene is also one of the causes for the cancer. An oncogene is a mutated gene that has the potential to cause cancer. Before an oncogene becomes mutated, it is called a proto-oncogene and it plays a role in regulating normal cell division. And an example of an oncogene is the HER2 gene that makes HER2 proteins. This protein helps control healthy breast cell division and growth. Oncogene happens when extra copies of these genes are produced, which causes cells to grow rapidly. The HER2 oncogene is found in some breast cancer and ovarian cancer cells.
The immunity system can be broadly divided into two parts, innate and adaptive immunity. Innate immunity is the body's first natural defense to any pathogen. Its primary goal is to prevent any pathogen from entering the body. The first component of this defensive system is our skin and the mucous lining of all our organs. These are the two physical barriers. However, we also have chemical barriers such as the lysosomes in the eyes or the acid in the stomach. The next defense is inflammation is done by mast cells. When they find pathogen, they release the signal in the form of histamine molecules. This causes inflammation and also bring leukocytes. The leukocytes are common in many types. Each leukocyte has its own function that helps in body defense against pathogen. For example, natural killer cells in the innate immune system destroy infected host cells to stop spread of infection instead of attacking the pathogens directly. Next, there is also the adaptive immune system. This system is more efficient as it can differentiate between different types of pathogens. It has two main components, T lymphocytes and B lymphocytes. T cells come into contact when infection has already occurred. B cells then join the fight when the pathogen enters but haven't yet caused any disease. Some T cells take signal from the dendritic or macrophages and that's called helper T cells. Helper T cells also form memory T cells which keep record of the antigen for future reference. Furthermore, we have B cells that produce antibodies which feed on the antigens of pathogens. They signal the macrophages to come and kill the marked pathogen. B cells also produce memory B cells when they encounter an antigen.
Cancer immunology investigates interactions between the immune system and tumors. The cells of the immune system that kill cancer cells are CD8 plus cytotoxic T cells and natural killer cells. First is the CD8 plus cytotoxic T cells. Antigens are proteins expressed outside cells. In normal healthy cells, a normal healthy antigen is presented on the outside of all nucleated cells of the body by a molecule known as MHC1. CD8 plus cytotoxic T cells do not kill cells expressing the normal healthy antigen. However, as cells become cancerous, their DNA becomes mutated. This can lead to a tumor version of the antigen. T cells with T cell receptors that match the tumor antigen will become activated by the antigen. In order to activate the T cells, dendritic cells present a different cell's antigen on the MHC2 receptor. CD4 plus T helper cells become activated by antigen presentation of MHC2 on dendritic cells. The CD4 plus T helper cells will then stimulate the proliferation of CD8 plus cytotoxic T cells. This results in an increase of number of T cells that can kill cancer cells. When a CD8 plus T cell binds its receptor to the tumor antigen on the MHC1 on cancer cells, it signals the T cell to kill the cancer cell. The T cells can also kill cancer cells by directly inducing apoptosis, which is the death program built into cells and result in death of the cell. Natural killer cells or NK cells help the immune system kill cancer cells without antigen presentation. Natural killer cells have two receptors on their cell membrane, the activator receptor or NKG2D and inhibitory receptor KIR. When cells are under stress, such as genetic mutation in cancer cells, they produce stress proteins outside their membrane. These stress proteins bind the activator receptor on natural killer cells and stimulate them to kill the cancer cells. However, if the inhibitory receptor is also bound, it will stop the natural killer cells from killing. MHC1 can bind to the inhibitory receptor of natural killer cells. As a cancerous cell becomes less able to produce MHC1, it is less able to bind the inhibitory receptor on natural killer cells. Cancer cells increase the number of stress signals that activate natural killer cells, which proceed to kill cancer cells by releasing granzyme B or expressing the fast ligand and inducing apoptosis of the cancer cell.
There are many treatments available for cancer, for instance, from the most to least common. Surgery is where it removes the cancerous tissue and sometimes the healthy tissue surrounding it in order to prevent the regrowth of the cancer. This surgery treatment is performed for many types of cancers and has a high successful rate compared to the other treatments. The second one is chemotherapy. It is a drug treatment that kills the fast-growing cells in our body like cancer cells, but sometimes can be the normal cells. It can be given by various routes. This treatment also can be given for many types of cancer and at any stage of the cancer, but the successful rate varies. It also has its own side effects. Radiation therapy uses beams of intense energy to kill cancer cells. High energy beam from a machine will target the precise point of tumor on our body and shrink and eventually kill the cancer cells. It is highly effective, especially for localized cancer cells. It has its own side effects but lesser compared to the other treatments. Immunotherapy stimulates our immune system to recognize and attack the cancer cells, and these are the three main types of immunotherapy. In non-specific immune stimulation, drugs will increase the overall immune response, which will help to kill cancer cells. T-cell transfer therapy is where you extract a patient's T-cell and then modify it into a receptor that will target a specific cancer antigen and infuse it into the patient's body. Immune checkpoint inhibitors is where the drugs induced into our body will block some protein on the surface of cancer cells and activate the T-cell to recognize and kill the cancer cells. Immunotherapy is becoming more common and shows success for these particular cancers, but the successful rate varies. There have been recent developments within the available cancer treatments in the market, such as with atezolizumab, also known by its brand name Tecentriq. It is a monoclonal antibody used in cancer treatment, falling under the category of immune checkpoint inhibitors, which is under immunotherapy. Atezolizumab aims to activate the immune system, enabling it to recognize and combat cancer cells more effectively. However, now, rather than waiting up to an hour for the drug to be administered by intravenous infusion, the National Health Service of England will be the first in the world to utilize it as an injection for cancer treatment. The injection takes only 7 minutes to deliver. Not only will this expedite patient treatment, but it will also free up time for medical staff. Atezolizumab is a medication used to treat malignancies of the breast and lung. It is anticipated that the majority of the 3,600 NHS patients in England who are now receiving the drug intravenously will now switch to the injection.
Cancer immunotherapy has a history dating back to the late 80,000s, when surgeon William Coley observed tumor regression in a patient with erysipelas, leading him to believe that stimulating the immune system could treat cancer. Despite initial success, this approach fell out of favor due to lack of control and the rise of radiotherapy and chemotherapy. However, Coley's idea laid the foundation for today's successful cancer immunotherapy. Tumor immunotherapy has made significant progress in the last 5 years. A PD-1 checkpoint inhibitor is a type of cancer immunotherapy that is utilized in certain circumstances where the cancer is not responding well to the standard treatments, like surgery and chemotherapy. After several months of treatment, scans show a significant decrease in tumor size, relieving initial fears about an apparent increase in tumor size during the early phase of the condition. The patients show increased vitality and diminished pain, suggesting a favorable reaction to the immunotherapy. While treatment options have improved, adopting a healthy lifestyle is crucial to reduce risk of developing cancer. First, we must create a balanced and healthy diet comprising lots of nuts, vegetables, whole wheat and lean meat. They include vitamins, minerals and antioxidants that assist in immunity system strengthening and prevention of cancerous cell formation. Conversely, excessive consumption of processed food like red meat and sugary snacks has been linked to an elevated cancer risk. Engaging in regular physical activity is also crucial, as it not only helps maintain a healthy weight but significantly reduce the likelihood of developing various cancers. Activities such as brisk walking, swimming or cycling for at least 90 minutes a day contribute to an improved immune system and overall well-being. Additionally, protecting the skin from harmful UV ray is imperative in preventing skin cancer, with measures like wearing protective clothing, using high SPF sunscreen, and avoiding tanning beds. Early screenings such as mammograms for breast cancer and colonoscopies for colorectal cancer are vital for early detection, leading to better treatment outcomes and increased chance of survival.
Cancer immunology is a branch of immunology which explores how our immune system can fight cancer. Understanding this field is crucial to help us change how we treat and prevent cancer. As cancer cells have tricks to escape the immune system, researchers are developing new strategies like immune checkpoint inhibitors that target proteins like PD-1. This inhibitor enhance the immune response, making the treatment more effective. Understanding how cancer avoid detection has helped train the immune system to recognize and destroy cancer cells. Notably, treating melanoma, lung cancer, and lymphoma with PD-1 antibody has proven very successful, wiping out tumors and increasing survival rates. In essence, cancer immunology is a revolutionizing cancer treatment by unlocking new ways to activate our immune system against cancer.